Hi, I'm Avery, the host of Dream Job Diaries, the podcast where you can hear real stories of real careers, the good, the bad, and everything in between. Find out how people turn their passions into paychecks. Today's guest is Manj Sharma, who started in pharmacy and now works on clinical planning for a new hospital. We'll explore what a career in healthcare really looks like, the challenges, the rewards, and the lessons learned along the way. Hi, thank you for coming today. If you could introduce yourself and a brief summary of what you do.
Sure, Avery. Hello, everyone. My name is Manj Sharma. My friends call me Manj. I am a pharmacist by training with a passion for clinical care, teaching, and healthcare leadership. My career has been shaped by commitment to patient-centered care and continuous growth within the hospital setting. I began my professional journey as a clinical pharmacist, spending over a decade supporting patient care in rehabilitation, surgery, and acute medicine units in a hospital. And during this time, I also served as a teaching assistant with the Faculty of Pharmacy at the University of Toronto, where I enjoyed really mentoring future pharmacists, or as I like to call them, future colleagues, and sharing my clinical insights. Over the years, driven by my desire to make a broader impact on the health outcomes of the people in my community, I transitioned into some leadership roles within the hospital. I became manager of the pharmacy department and then expanded my scope to manage some clinical patient units and eventually oversaw outpatient medicine clinics across all the 3 sites. While balancing all of this, I also completed my master's in healthcare administration, all while raising a family of 5. And in 2020, when COVID-19 pandemic reshaped healthcare priority, was reassigned to lead some critical initiatives at my hospital, which is Trillium Health Partners, and then later actually helped lead the mass vaccination clinic, where my team successfully administered nearly 400,000 doses to the community. Probably the most scariest time in my healthcare career and the most rewarding. After that, I am in the job I am now. I was honored to join the clinical planning team for our new hospital, the Peter Gilligan Mississauga Hospital, and the future home of the Shaw Family Hospital for Women and Children, which will be the largest hospital build in Canada and the second largest hospital build in North America. And I currently serve as manager of clinical planning for this transformative project. And despite all this, I still work in a community pharmacy setting 2 to 3 times a month to stay connected to patients and keep me grounded, and which helps maintain my clinical skills and the compassion that first drew me to become a healthcare professional.
What does your current day-to-day look like?
So over the years, I think my day-to-day has definitely evolved significantly. Early in my career, like anybody else, I was working a lot. I was working up to 6 days a week, sometimes 7, balancing full-time hospital work with evening and weekend work in community pharmacies. At the time, it was, we have a lot of student debt when you come out of university, and there was a big demand. So I took advantage of that to help pay off that debt and just learn my skill better. But that being said, that demanding schedule helped me build a strong foundation in both hospital and retail pharmacy practice. Now my day-to-day, more than 20 years later into my career, my routine looks very different. In my current role as manager of clinical planning for Trillium Health Partners, I work primarily from home, contributing to the design and development of our future hospital. My days are filled with collaborative meetings involving a diverse team of professionals, of architects and engineers, redevelopment experts, infection prevention and control specialists, and so many others, focused on shaping the clinical spaces of this new facility. My role is to bring the clinical lens to these discussions and provide input, offer feedback, and liaise with frontline clinical teams to ensure the design aligns with their needs and workflows. I'm on site probably maybe once a week to stay connected with the teams and to work on more of the physical aspects of the project.
What would you say you enjoy most about your career or what you do?
I think one of the most fulfilling aspects of my role is being able to influence the design and planning of a hospital that will deliver like the highest quality of care to my community and very importantly to my own family. It's incredibly meaningful to contribute to a project that will shape the future of healthcare for generations to come. As a pharmacist, I find a deep satisfaction in helping individuals manage their medication safely and improve their health outcomes. I think every healthcare professional would tell you that the direct impact on a person's well-being is truly rewarding. Now, being part of the design team for the largest hospital in Canada, I have the opportunity to help improve health outcomes on a much broader scale. Knowing that my work will support thousands of patients and healthcare professionals is both humbling and inspiring.
Thank you. Now that we've learned a bit more about what you do, we're going to kind of take a step back and see how you got to this point, starting with what was your first job? Did you enjoy it, and do you think it was beneficial?
I actually love this question. My first job was at McDonald's. When I was 15, 16 years old in Unionville, Ontario. And I stumbled into that job at McDonald's thanks to my twin sister. She was hired first, and when the manager at the time found out she had a twin, he was so excited about the idea of having both of us on the team that he hired me on the spot. No interview at all. And at one point in time, we were both even working in the drive-thru, if you can picture us, in window 1 and window 2. One of us handling payments and the other one handling food. It was definitely a sight to see and a lot of fun. I actually ended up working there for almost 2 years. I didn't plan on it, but I genuinely enjoyed the experience. It was tough work, especially for about $5 an hour, which was minimum wage at the time. It taught me so much, like lessons that have stayed with me throughout my career. The most valuable takeaway was learning how to really work efficiently under pressure, multitasking, communicating clearly, and delivering great customer service. Like all of those skills that have been so essential in every role I've taken on since.
Would you suggest for other people to get a minimum wage type job when they're younger?
Yes. I have 3 daughters myself, and 2 out of the 3 are at that age where they can work, and they've been working for over 2 or 3 years now. Yes, absolutely. I think that understanding how much work it takes to earn a dollar is significant to one's growth. And the ability of truly appreciating good customer service, or even appreciating a new piece of clothing, understanding the money that it takes to buy that and the work that it takes to make that money is really important to everyone's growth. And I think starting it at a young age just will definitely make them wiser and understand the value of the dollar better, and hopefully they'll learn how to manage their money a little bit better.
When you were younger, what did you want to do, and kind of how did that change over the years?
Another great question. It's funny because my kids ask me this all the time, and they're at that age now where they need to kind of decide what they're going to do. When I was your age or a little bit older, like back then, the careers you knew about were usually the ones the people around you had. My dad is an engineer, and since I loved math, I thought for a very long time that I'd follow in his footsteps and become an engineer too. But in high school, I discovered I had a real aptitude for chemistry and biology, which led me to focus more on the sciences. I still didn't have a clear plan. It wasn't easy to research careers and salaries or educational requirements like it is today. You really had to know someone who had taken that path to understand what it involved. And as a daughter of an immigrant, that kind of access and insight was even harder to come by.
At one point, did you kind of start thinking that what you currently do is kind of what you wanted to do?
So it wasn't. So when I when I finished high school, I did go into McMaster University under the biology program. Again, because I liked biology and chemistry, I thought I could do something with that. While I was at McMaster, I met a friend of my sister's who was at the University of Toronto, and he was studying pharmacy in the Faculty of Pharmacy at University of Toronto. And it was that guy that suggested maybe I look into pharmacy as a career, because it was a career that kind of focused on my passions, biology and chemistry. And through conversations with him, I looked into it more and ended up applying to the Faculty of Pharmacy and getting in. And that's kind of how I started my path this way.
How much education was required to kind of acquire your job and like the ones you've had previously?
So to be a pharmacist in Canada today, you need to have a doctorate of pharmacy degree. At the time I did it, you had to be in an undergraduate program, and I was in a biology program at McMaster, and then I applied into the program of pharmacy at the University of Toronto. So now it's still a similar process, but now the degree is a doctorate. In terms of my leadership at the hospital, I've also completed my master's in healthcare administration. It's kind of like an MBA for healthcare. That master's has really helped me get into the roles I am now. The pharmacy degree gave me the clinical skills and the professional knowledge to be a healthcare professional, but the master's took it one step further to help me understand the business of healthcare.
I know you said when you were younger you thought you were going to be an engineer. Were there any other like careers or jobs you like really considered before deciding on your current industry?
If I could go back, I think if I could go back and tell my younger self something to do differently, I wish I had known more or taken more time to figure out a clearer path. I also wonder if things might have been different, like if my parents had pushed me a bit harder. In many ways, like my parents are atypical South Asian parents. They trusted the education system and didn't get too involved in our academic choices. My sister and I generally did well in school, so they probably felt they didn't need to intervene. I think if I could go back, I would still choose a career in healthcare, but I think I might have pursued medicine and become a doctor. That said, I'm still proud of the knowledge and skills I've developed as a pharmacist and a healthcare leader. My journey overall has been meaningful and rewarding, but if I could tell my younger self what to do, I think I would look at that slightly different path.
What would you say, kind of a bit more talking about some of the harder behind the scenes part, what would you say is the hardest part of your job currently?
I think one of the biggest challenges I've faced in my career has been navigating the leadership roles as a woman of color with a very unique name. I know that sounds a bit weird, but it's different. 20 years ago, the landscape of diversity, equity, and inclusion was different, and I often found myself in spaces where I was one of very few who looked like me or had a similar background. And there were moments where I felt overlooked or underestimated, but not because of my abilities, but simply because of unconscious biases and a lack of representation. I mean, it took resilience. I had like self-advocacy and a strong support system and some pretty great mentors to push me through some barriers and continuing growing my career. But like despite all those challenges, I've remained committed to my path, and I've learned like I've actually leaned into opportunities to lead and to mentor and to contribute meaningfully to healthcare, like through clinical work, leadership, or hospital design. But especially as a leader with, being a woman of color with a unique name, over the last few years especially, I have found the younger generation, actually opening up to me and saying that it's nice to see somebody like me in some of those roles. I'm proud of how far I've come, and I'm hopeful that the progress we're seeing with diversity, equity, and inclusion will make it easier for future generations to thrive without having to fight quite as hard to be seen and heard.
For your industry, it's changing. All of them have. Are there any ways you've been like adapting to that?
I think every industry is changing, Avery, in terms of, the technology, the AI, a lot of unknowns about what, a career looks like today may be different tomorrow. I'll use the example of being a pharmacist. Like when I first started 20 years ago, the role was less technical. The computer systems were more basic. The work, as I look back, felt more basic. But over the years, there's been tools and trades, like even robots have come into the play for helping to dispense medications and stuff. But the role of the pharmacist has adapted with it. And it's, even though it may feel strange to think that some of the things I'm doing now is not even stuff that I may have studied when I first took that degree, I think that's normal. I think that's normal in any career path. When you work in an industry for 10, 20, 30, 40 years, there's so much change. And there will continue to be change. And I think the important thing is to remind people to ride that wave of change. Don't be afraid of taking on something because there's going to be change. The change is part of life.
What would you say is a skill that helps you to perform well that may be less obvious to people?
That's a good question. Here's what I tell a lot of my young students is that, I don't know if it's a skill, but I would say always challenge yourself. Put yourself in a position, take on opportunities that is out of your comfort zone. Don't stay in the same place for too long because it's easy and comfortable. I think every person will grow in their career and grow as a person if they continue to just, take the road less traveled by, or say yes before saying no, and just lean into change, take a leap of faith and try something new. And I think that is the secret to success, because you can always go back. Like, I can always be a pharmacist. I have that safety net. I can always go back and take 2 steps back if I need to. But if you're given an opportunity to try something new, take that challenge. Don't be so afraid of it. Because yes, it's going to be tough. It might be tough for a little while, and it takes time and takes practice to become good at something. Give yourself that chance.
Speaking of challenges, what's the biggest challenge you've had to overcome in your career?
No, I think I kind of touched on that with the diversity, equity, inclusion part. I'd also say that taking on leadership roles in this hospital, traditionally it's a lot of physician and nurses that take the leadership roles. It's not really common for a pharmacist too, so even there's a little bit of a bias with that. So that's been a bit of a challenge. I think trying to balance having 3 kids, like having a family of 5, doing a degree at the same time, like finding a good work-life balance over the years has been tricky. And I think that, again, and I tell people this, like, you may think, I'm going to do this degree, but I don't have time. And I can tell you, you do. You will have time. If you commit to something, you will find the time and you will get it done. But you have to make that commitment. You have to take that step. You have to sign up for that degree or apply for that degree. Because nothing will happen if you just keep saying, what if, what if. Take a step and move forward. And just, get yourself through it. And I promise you, once you do, be happy you did.
Is there anything you wish you had done differently when you were younger, kind of like relating to getting where you are now?
In terms of the career path I've had at the hospital, no. I don't think I would change the way I've traveled through my organization. I've taken different paths. I've gone backwards a couple of times, but everything I've learned in my career, especially about hospital operations, my master's, everything I've done has brought me to the position I'm in now, where my knowledge and skills of operations across the hospital, like inpatient care, outpatient care, pharmacy department, has really made me an expert in hospital operations and given me the ability to do the job I'm doing now. So I'm thankful for that.
What would you suggest to those who are interested in your field or learning more about it?
I think for individuals who are curious about careers in healthcare, there are always 2 main paths to consider. So there's always like the clinical path where you can become a healthcare professional, like a physician, a pharmacist, a nurse, a physiotherapist, a social worker, and you can do that role and grow into leadership roles within your organization. And that path allows you to do direct patient care and then later influence systems and strategy. You could also go into, in terms of healthcare design, I've met a lot of people who have come through the design and infrastructure path. They pursue educations in fields like engineering, architecture, interior design, health policy, or even just healthcare administration This path focuses on creating environments that support safe and efficient patient-centered care. Both paths offer opportunities to make a meaningful difference in people's lives, and the key is to stay curious and seek mentorship and explore the many roles that contribute to the healthcare system.
Now, what would you suggest to someone who's unsure what they're interested in doing?
I think if you're unsure about what you want to do, you're definitely not alone. That's completely okay. I think many of us start without a clear path, especially when we don't have access to people in different careers or the resources to explore options deeply. Again, looking back, I wish I had taken more time to explore and understand the possibilities of what could be. But today, I would encourage, and I do encourage, my own kids. There are so many tools available to help you learn about different fields. Use them. Talk to people in various professions. Ask questions. Don't be afraid to try something new, even if it's outside of your comfort zone. Try and start by identifying what you enjoy, whether it's working with people or solving problems, being creative, or organizing systems. Even listen to the people around you, listen to your parents or the people that know you so well. They'll tell you they'll look at you and know what your strengths are, and they'll tell you that. And look for roles that align with those strengths. Volunteer, take on internships, shadow professionals, anything you can to get some experience. Real-world exposure is one of the best ways to discover what resonates with you.
So now, as we're kind of wrapping up, is there anything else you would like to add?
Yeah, I'm going to add one more thing to what I just said. I would tell people as well, when you're not sure, it's okay to have your first choice not be your final destination. Careers evolve. Mine certainly did. From pharmacy to leadership and hospital design, I never would have, if you would have told me I was going to be doing this role, I never would have guessed it. Again, what matters the most is stay curious and open-minded and always be willing to grow. For me, looking back, my career has been shaped by curiosity to try something different, a little bit of resilience, and a commitment to the healthcare system, especially the hospital that I'm at. It's a hospital that means a lot to me because it's part of my community. It's where my loved ones have been cared for. For my early days as a pharmacist, leading large-scale initiatives and now helping design the future biggest hospital in Canada, each step has taught me something different and something valuable. To those still figuring out their path, take your time, explore widely. Don't be afraid to pivot. Whether you're drawn to direct patient care or the systems that support it, there's a career for you in healthcare. And no matter where you start, your experiences will shape a career that's uniquely yours, just like mine did.
Okay. Thank you so much for coming today.
Thanks, Avery. Thanks for having me.
If you've made it this far, thank you so much for listening to the second episode of Dream Job Diaries. If you have any recommendations, feel free to comment them. And if you are interested in being on an episode, you can send me an email. Thank you so much for listening and have a fantastic day.